drink. Multiple sclerosis is a chronic neurological autoimmune inflammatory demyelinating disease of the white matter of the central nervous system, result in various neurological signs and symptoms in the body's defense cells. Well, and is one of the most common cases of a chronic neurological disability in young adults. The case involves a genetic predisposition and environment factors, as well as viral infections, sun exposure, and consequently prolonged and long vitamin D levels. Well, the cognitive dysfunction in multiple sclerosis is characterized by deficits of memory, attention, information processing speed, and executive functions. The cognitive impairment of MS patients is considered moderate when compared to normal people. Well, in general, the overall prevalence of cognitive impairment is about 45 and 65. Okay? This case have the keywords about multiple sclerosis, neuropsychology, neurotoxicity, drug abuse, and mental health. And we talk about a patient. Is a male, 28 years old, right hand, in the graduate yet, previous health, and was admitted in the hospital that I work due the neurological symptoms like ataxia and tremor and cognitive disorders following the ingestion of a prison manufacturer illegal alcoholic beverage, a moonshine, and stories of previous use of MDMA, ecstasy, and cannabis. The patient was evaluated to the neurological and neuropsychology service team here, and have a diagnosis of multiple sclerosis, ICD, and G35. Additional diagnosis, you have Harlequin syndrome and Horner syndrome, left face. About neuropsychology assessment, we saw the MRI, and the MRI exam indicates supra and infratemporal demyelinating lesions in the cervical spine, some which indication of inflammatory activity, and degenerative disc disease had C5 and C5 and C6 and C6 and C7. The neurological assessment during of the first hospitalization attests extremely IQ in the WASI and the generalized cognitive deficit. 2 years and after, in a second neuropsychology assessment, the patient show the same IQ qualitative classification, IQ 43 percentile lower, and I01 or 1 confidential interval 95, 42, and 53. But lower scores in vocabulary, matrix, reasonable, and both important deficit. Well, the verbal memory was assessment and resulted in a deficit and recent memory and recall memory. And neuropsych are 37 score, worse in writing, and MSI mental exam, worse in writing, orientation, drawing, immediately memory, auditory discrimination, and attention. The trail making test is a screening about inhibitory control and the CDT, both in deficit. These patients show signs of frontal release with inappropriate behavior, including impairment judgment, impulse modulation, and aggressive and sexual modulation. The patient health state deteriorated between longitudinal neuropsychology assessment. This situation we can wait. If you think about the multiple sclerosis, have some signs and symptoms in central condition like fatigue, cognitive impairment, depression, anxiety, unstable mood, and other conditions like ataxia, dysarthria, pain. Well, it's a group, important group of manifestations. The treatment and healthcare in this case included use medication, use the methylprednisone, levodopa, haloperidol, clonazepam, and immunosuppressant, combined with neuropsychological psychoeducation to the patient, family, and the health team is very important. And I'd like to say that this present case with ramification from primary healthcare to the right complexity hospital procedure shows the importance of multi-professional healthcare, affecting the scope of medical care and the quality of life in the patient and his family. Well,